Okay, so I think we are officially live now. So sorry you all for the difficulties. I thought I had pressed the go live button and I did not. So we were just chatting a little bit, but we can backtrack. I'm Laura Harker. I am the Senior Health Policy Analyst at Georgia Budget and Policy Institute, and joining you today to talk to you a little bit about the budget for the Department of Behavioral Health and Developmental Disabilities in our state, which is included in our budget primer for 2021, which came out last month and outlines how the state is spending money on health services, including other agencies like community health and public health, which are also the 3 health agencies. And today I was focusing on talking a little bit about the cuts that were proposed and are moving forward to the Department of Behavioral Health and Developmental Disabilities. And I'm excited to be joined by Jewell, who is the Executive Director of Mental Health America of Georgia. And she has a lot of expertise on the mental health services we provide and how the budget really impacts people and their ability to access services. So Jewell, tell us a little bit about Mental Health America of Georgia.
Absolutely. So we are the statewide affiliate for MHA National, which is based out of Alexandria, Virginia. We are an education, outreach, and advocacy organization in order to improve the mental health and wellness of Georgians throughout the state. A lot of the work that we do is based on providing that mental health education, but also advocating at the local as well as the state level to improve access to behavioral health services and to ensure that people can promote their own mental well-being. So that just gives a little bit about us. So happy to be here today.
Thank you again. And so we'll get into some questions and discuss some of the proposed changes around the department and what they actually do. So for folks who are not familiar with the Department of Behavioral Health and Developmental Disabilities, otherwise known as DBHDD, it's a long name. They operate a variety of programs. They have a $1 billion budget, mostly funded by state general funds, and they provide mental health services, services for substance abuse disorder, as well as developmental disability services. They also coordinate with Medicaid because Medicaid pays for a lot of the mental health services in the state, as well as a lot of the disability services in the state as well. So focusing in on some of their mental health services, Jewell, can you tell us a little bit more about some of the services they offer across the state and how they help the people they serve?
Absolutely. So DBHDD is focused on they are the statewide behavioral health authority, which means they guide the policy and ensuring that the behavioral health services is accessible to Georgia's most vulnerable group of individuals. And that includes those who may have severe and persistent mental illness, as well as serious mental illness, and for children, serious emotional disturbances. They do really provide services through a provider network, where providers across the entire state will apply or submit applications in order to provide services within their localized community. One of the safety net of DBHDD is comprised of community service boards, which is the public mental health services arm that provides services and supports to their community and or catchment areas. So they are responsible for several different counties off of one facility. And they are primarily supporting those who are uninsured or who have straight Medicaid. So that is what's funded through DBHDD. These providers can also provide takes other insurance, such as private insurance or commercial insurance, as well as Medicaid, which is through the Department of Community Health. But they do disseminate those services out. And general services, you have what we call a core package, right? Core services includes therapy, individual, group, family therapy. It includes assessments, nursing assessments. So that primary behavioral health need is what we would consider core services. And you'll just make note of that because that's included in the budget to recognize how those services are being delivered. But they also provide hospital services as well. So they manage hospitals throughout the state. And these again are for individuals who are seeking more inpatient support and services. Most times they are either involuntary committal, or if they are at a point where they recognize they need services, they can also go to those hospitals as well. So they manage the hospital systems, and they also manage the community-based services, and they also offer specialty services. So for those who have severe and persistent mental illness, they may participate in assertive community treatment. And these are teams that are across the entire state that basically support those individuals with the most chronic needs. And when we're talking about chronic needs, it's an actual team of individuals that includes peer support, supported employment, nurses, psychiatric team, as well as psychologists. So all of those are combined, and they have contact points with those individuals in their homes, which is the advantage of accessing behavioral health services in the community. And there are some level of services that kind of degrades from that, but they do serve both children as well as adults, as well as older adults. And that is encompassing. And of course, you naturally have addictive diseases, which is also a part of that behavioral health arm. When we think about mental health, we have mental health, we have addictive diseases, and then you have developmental disabilities. Typically, mental health and addictive diseases combined, you'll look at that as behavioral health. So it is operated under one arm, and then our developmental disabilities is operated under another arm.
And building out on some of those supports people may not be aware of, supportive housing, is that also a support that has been a successful model within behavioral health? And could you talk a little bit about
Absolutely. So that's one of those specialty services that you look at when you look at supportive housing. And the state currently is operating under a Department of Justice settlement agreement. And a part of that settlement agreement is basically the state was sued. And in that lawsuit, there were certain stipulations and recommendations that were required to be implemented in order to increase access to behavioral health services in the communities rather than staying in hospitals for longer than they need to be. Most times staying in the hospital, that's just to maintain and stabilize what someone may be experiencing. But the idea is that everyone can live in recovery, and they can live in recovery in their community without being isolated or feeling as if they cannot integrate in day to day. So supportive housing is one method for individuals to increase that access, particularly for those who have severe and persistent mental illness. They can access housing vouchers. They partner with the Department of Community Affairs, which is DCA. They connect in providing housing, and they are over a lot of other housing, such as Section 8 and others. So this housing element was an opportunity for people who do have mental illness can access housing, because housing is important. Housing, employment, supported employment is another specialty service that is offered in the community. Support those so that they can live in recovery overall. And these are all very successful program models to really help and empower individuals to have more independence, to live in a life independently, fruitfully, and productively overall.
Well, that is great. I mean, I think you cover just the importance of all of the services that they provide, not just direct services, those core services, as you mentioned, that are so important, but those supports that really help people be able to stay in their homes and not have to be institutionalized, as we've made that transition as a state over the past 10 years. So, you know, the budget has increased a lot over the last several years because of that Department of Justice settlement, which has been exciting to see, at least over $250 million in the last, since 2011 or so. But this year, we unfortunately did not see any increases. We saw a 10% cut across the board to those services within the department, and that amounted to about $90 million lost just for this upcoming year. And these cuts are also coming at a time where we're hearing about more needs around mental health, stress, anxiety. People are dealing with responding to the COVID-19 pandemic and being isolated and at home and trying to figure out moving forward during this time, and potentially having family members get sick and worried about that. So there's a lot of mental health needs that are arising and building. There already was a need, and there's an acute need now. So what do these cuts actually look like as far as mental health needs for Georgians moving ahead?
Well, naturally, as a mental health advocate, there was never enough money in that budget in the first place, right? Because it's very complex. And just like any other healthcare, when you think about the healthcare industry, the amount of needs that are required to support individuals overall, You need that same level of funding for mental health and behavioral health with addictions as well as mental illness. But the idea is that there wasn't really enough money there in the first place. And with them taking from that, this is impacting Georgians everywhere, particularly at a time where the pandemic is climbing, and more folks are losing employment, and more folks do not have access to health insurance because of that loss of employment. So having to rely on the public mental health system when they are in that level of need in order to access service and supports. And the goal, of course, overall is to ensure that people access service and supports early on, to prevent higher costs where you may see hospitalization or incarceration, because that's also a large behavioral health arm, unfortunately, when we think about how people interact into our systems, and most times it ends up in the legal system. So looking at those cuts, when one, we were grateful that they were able to preserve the core services, because the core services have not had an increase in many, many, many years. And those services, that funding is then broken out in order to be allocated to all of those community service boards, to that safety net that right now it's what's holding our system together. It's where people can go when they need public mental health services. So when you take away, other areas such as supported employment, even for children, having reduction in some of the specialty programs such as clubhouses, Apex, although Apex was also preserved within that realm, you have to really kind of play juggling and with the funding. You move this over here to get this over here so you can preserve this. And all in all, who is suffering are Georgians, right? So the idea is having those services cut, housing vouchers, which is extremely important, particularly are those individuals are transitioning out of prisons, as they are transitioning from homeless shelters, as well as hospitals. That lack of access to those vouchers can impact their ability to be successful in the community. Supported employment, when we think about if anything else is going to empower someone, is having employment. That program in itself allows individuals to continue to work in places that offer competitive wages, but also connecting to someone so that when things become overwhelming or difficult, that there is someone there to advocate for them, to ensure that their rights are being met, and also just to provide that additional support that you don't see in other areas. So we already had a huge bucket of individuals who weren't able to access services, who are still learning about behavioral health, who are still understanding, and it gets to a point where they're meeting crisis. So when you look at the rates of suicide, particularly among older adults, for children, it's the third leading cause of death. These are certain things that we have to take into account, that when you do not have access to services, then you are more likely to engage in maladaptive behavior, such as increased substance use, drug abuse, opioid abuse is a huge issue in Georgia. Alcohol abuse has always been the most utilized substance or abused substance across the nation. And even in Georgia, we've noted that that was the one revenue stream that continued to go up versus any other. So even trying to manage, our own mental well-being and engaging in these coping skills that aren't healthy for us overall, it leads to a trajectory where our mental health outcomes are going to be compromised in a way that we can't provide support to those who needs it the most. Even in our rural areas, when they don't have access to broadband, they don't have access to behavioral health services because there aren't enough providers or enough of a community for a provider to be there to make sure they can get access. So in areas where, yes, telehealth was absolutely instrumental, but telehealth only works if there's internet access in order to have access to behavioral health services. So it's one of those issues where when we think about even prior to the pandemic, trying to get access to support and making sure that, all of these issues existed prior to our workforce shortages, not enough psychiatrists, psychologists, counselors. And then when you look at the disparities among people of color, brown, Black, Indigenous, that they don't have access to support because they can't within the Atlanta metro area, transportation is still a huge barrier for people to access care. So if it's already difficult in an urban population, just imagine more challenges in a rural population. So looking at all of that and the impact with ongoing budget cuts, and then a population that is slowly growing because we are all just trying to maintain in this pandemic. And even though we're seeing numbers fluctuate, the uncertainty of it all, it increases those stress hormones in our body that, again, it's going to have a physical impact on us. So we're going to start seeing more hypertension, more diabetes, more of these chronic health conditions as a result of the stress that we are facing. And Georgia needs to take a better step in advocating to ensure there are services and supports throughout, not just for those who are severe and persistently mentally ill, but for those who are up and coming with mental illness. Are there enough providers out there? Are we doing enough to really support those across the entire state? All Georgians are being impacted with the pandemic. And I'm not sure that we are in a position to truly support those with the budget cuts. And I know there have been talk that, budget cuts won't happen again, but I also know if revenue streams aren't rising, then what's probably going to happen, right? We were facing a 16% cut, or was it 14?
Originally, I think it was 14%, and then it went
14,
from 11 to 10. So yeah.
Right. So I worry about, are they now thinking about, well, do we need that extra 4%? It's just the uncertainty of it all. And I think, not having those services in the community the way that we need to, so that people can feel independent. It's not just with DBHDD's budget, but it is across the board for all the state entities that provide behavioral health services in some form or fashion. DJJ, DFACS, Division of Family and Children Services. I know we have so many acronyms, but
Yeah.
even, public health and providing that public health messaging. There is just so much that we can really take a stand to and really get involved in talking about how these cuts are hurting those where, again, everyone has mental health. Not everyone has a mental illness, but everyone has mental health. And having these cuts looming above our heads and trying to figure out revenues, it looks like we're putting money over people. And we want to make sure that that's the reverse, that we're putting people first, and our economy will thrive as a result of it.
That's great. And you also mentioned the providers. I know that the department had to cut many jobs, over 200 jobs. Is that having an effect on the provider pipeline as far as, providers being able to feel like they have security in this field and that there's enough providers in different areas? Like, how is that affecting folks so far?
Well, and I think, the provider shortage was already very evident prior to the cuts happening initially, but we're still waiting for what will this impact look like. One of the biggest impact, particularly when you think about how many cuts were at the hospital level, right? And a lot of these folks who were working in hospitals, that direct care staff, they were barely making livable wages. So just topple that with the fact that they have all of these additional expectations from the pandemic, and trying to keep their own sanity to provide support to those who are so vulnerable, their own, and recognizing that everybody is dealing with this pandemic in some form or fashion, so just imagine the uncertainty of, is my job secure? Or, can I continue to provide the support? So, I think about all of those challenges, but I think, it will take a few months to really look at what is the impact of those budget cuts, outside of people loss of job or just not feeling safe in their employment or just not feeling safe in the pandemic and still having to report to work. But also looking at providers, before this happened, we were already losing providers. So now that we have these additional expectations, you have whole programs that's been cut from a lot of different providers. So looking at the sustainability without having those providers, those dollars in place, this is where we're going to have to take a hard look at what is the true impact of these cuts. Because it's not just, okay, this is on and gone. there is
Right.
going to be that toppling effect, that snowball effect of it started with this, and now it's become such a larger issue because if you had one provider who lost program funding in each of the areas that were cut, then how do they continue to sustain? You know, these are quasi-governmental entities. You know, they're limited in their fundraising, they're limited in accessing other dollars. You know, federal dollars are available, but again, you know, with COVID, it's hard to access anything because everything is focused on the pandemic. So when we think about mental health, there isn't the accessibility that we would like, or even the opportunities to identify additional revenue streams so that they can be sustainably with operations overall.
Great. So you already touched a little bit on some ways to advocate, such as raising revenue, but to end on the conversation, we definitely saw advocates from the mental health services community, substance use disorder community, developmental disability services really all came together to help advocate to restore certain cuts. So what would you say to people who are trying to get involved in the budgeting process and what they can advocate for?
And the budgeting process is complex, right? This is why we rely so heavily on our GBPI partners because they do such a great job of making it very simple. But starting there, you know, looking at the budgeting primer, you know, it really just gives you a basic understanding of the budget. It's a lot though, right? So you can't grasp all of it together. So the idea is to follow advocacy organizations. You can follow MHA, you can follow NAMI Georgia, you can follow the Georgia Mental Health Consumer Network, all of those who are working to support those who are at greater need, and then recognizing where does it impact you, right? The idea is to identify whether it is personally or directly impacting you, or maybe indirectly impacting you. Because even if it's in your community where these behavioral health providers are being cut, where do people go when they need to access services? And most times it ends up in incarceration. So that increases your tax dollars. Sometimes it's homelessness that increases your tax dollars. So even if you're not directly linked to behavioral health, you are linked to behavioral health.
Mhm.
Because it does come out one way or the other. So either we can directly have funding to support it, or we're going to see it where it's itching and etching away at so many other resources that we're so comfortable in having access to. So starting paying attention, you know, right now, guess what? It is an election year. So vote. You need to know
Yes.
who your legislators are, asking questions, understanding what their role is and what we can do in order to resolve this, or at least develop some solutions that will support those who are most vulnerable. Because again, if we are, one of us are impacted, all of us are impacted. So making sure you talk to see those who are campaigning. I know you're probably tired of getting all those messages. I know I am, but pay attention. Pay attention to what's important to you and engaging your legislators. And then the next piece that you can do once you recognize who they are and you've already gotten through the voting process, engage them again once they are in office. Our legislative session begins in January, but they're already in November thinking about what they want to push forward, what
Right.
their agendas are. So really paying attention to what's happening across the board. Stay connected to the governor's office. See what's coming out of that office to pay attention if things are changing. What is the impact? What does our economy look like? Because all of that is going to help you get to a decision of where can I become most involved. But absolutely looking at the legislative session doesn't mean you have to be in Atlanta to be at the state capitol. It means what's within your local community. So if you don't want to do it at the state level, local levels, who is your mayors? Who is your commissioners for your county? Who is your state government, I mean, your county government that you can talk with some of these issues about and knowing where to access service and supports. I do just beg that whatever you do and however you want to get involved and have a voice, that you have one voice. You have an opportunity to say and talk about things that are important to you, so that we can make a better change. Because, you know, one change for all, again, it helps all of Georgia when we can come together and advocate for those who are most vulnerable, because one thing about behavioral health, it does not discriminate. It doesn't matter who you are, what color you are, socioeconomic status. So the thing is, you never know when it's you. This trauma, this collective trauma that we are experiencing, your brain is only so fragile, right? As powerful as it is the most fragile organ in our body. So when things aren't going the way that we need to, we already have this pandemic brain, our memory loss, our stress, our sleep is disrupted, our eating habits may be over or under. Looking at those areas and making sure that where do I fit in this? And how can I continue to advocate across the board, not just for those in the community, but also just for myself, because I never know when I'm going to need that level of support.
Yeah, that's a great point. And just getting involved early in the process and contacting your lawmakers is a really good point, since the budget process is already getting started with agencies starting to put out their budget. So you don't have to wait just until the January session. And also, of course, just acknowledging, Jewell, as you said, some of your wins in the mental health advocacy community. Wins are possible. Just because a budget comes out with a lot of cuts doesn't mean you give up. That you see some wins in core behavioral services and some other peer supports as well, I believe. So there was a few additions that advocacy is really making a difference in that way. I think that was it. I think that was a good closing that you gave, just to give everyone some advice on how to really get involved in pushing for more funding and services for mental health. Do you have any parting words?
No, I just encourage people practice self-care daily. We do have a lot that we are experiencing, so taking time for yourself, self-compassion is very important during this time. If you're not gonna, tell your friend all the things they shouldn't be doing, then don't tell yourself that, right? Be compassionate to yourself and just remember that we're all in this together, honestly. So I do hope to see all of you in the session, or at least some way that I can connect with you all. And let's continue to have one voice as it relates to behavioral health.
Great. Thank you so much, Jewell.
Thank you.
Everyone.